host, Mad Dog. Today I'm talking about an email I received. Abstract. Depression is a disease state that is commonly underdiagnosed and undertreated, and patients over the ages of 65 years old. Elderly patients may differ from younger patients in the presentation of the symptoms and in the prevalence of risk factors of the development of depression are different for elderly patients. Treatment may also be dissimilar, including response and response time to treatment. Treatment should be tailored to the individual patient and the geographic population to optimize therapeutic outcomes. Pharmacists can be prevalent of and medications that potentially increase the risk of depression in elderly. Pharmacists can be significant role in advocating for the screening of and treatment of this disease state. They are in a unique position to prove patient outcomes in late life depression. The American Psychiatric Administration Diagnostic and Statistical Manual of Mental Disorders, or DSM, defines late life depression as depressive symptoms in adults older than 65 years of age, including elderly patients who have experienced mood disorder or first time in life, initially presented earlier in life and are now reoccurring. The diagnosis of depression in elderly patients utilizes the same criteria as younger adults. The diagnosis may be more difficult in the elderly due to chronic medical conditions and medication use, disability, or cognitive decline. Depression in the elderly population is widespread and is often underdiagnosed and inadequately treated. Healthcare personnel who oversee care of the elderly may not be equipped to recognize or treat patients with depression. This is likely due to presentation of depression in the elderly, which is often atypical. Insomnia, anxiety, and fatigue, as opposed to typical depression mood reported by the younger depressed patients. Rather than reporting feeling sad or depressed, elderly more often somatic complaints such as chronic pain, weight loss, headaches, or gastral symptoms. The elderly are often dismiss their less severe depressive symptoms as an acceptable acceptable response of life's stress or normal part of aging. However, depression is not a normal consequence of aging. Late life depression, when untreated, has a significant impact on patients' quality of life. This is a pretty interesting article. I'm not going to read through the rest of it, but hit me up, djrabies@gmail.com. Let me know what you think about this. Like this video, subscribe to my page.